Okay, folks, tonight's D clears up some misconceptions about end of life for like palliative care nurses and people that do, us people that do end of life care. This explains the misconceptions about um death and dying for y'all. So I'm gonna go through the presentation for you. Okay, so here we go. It's a profound and often misunderstood topic. According to Lucy Dowland, a clinical nurse manager at Marie Curie, there are several things people often don't know about dying. For instance, the death rattle is a common occurrence in the last days or hours of life, where a person's breathing becomes loud and noisy due to mucus buildup in the airways. Understanding these aspects can make the process less daunting and help people feel less alone during an isolating time. Okay, this holds true. This holds true for your loved ones too. That's why when somebody asks you the question if you can handle being in the room, they want an answer for that question. They want to make sure that if you are their favorite person that they see every day, they want to make sure that you can handle being in the room with them as they pass. Now that it takes a special person to do that with, you know, it takes a person that understands the whole process of going. For me as an end of life and hospice person, I do understand that because when the one place where I volunteered, as a volunteer, you go through a course. It's called Death and Dying. When you're a volunteer for that facility, they put you through a course of death and dying. So you understand if you come across an elderly person that is on their last day, at the last stage of life, but they request a visitation from you, and you're a volunteer going into their room. They give you a course in death and dying, so you understand the process and everything, so you're not scared when you delve into volunteering for an elderly person. That part of it matters if you can handle that kind of stuff. Me, as an end of life care specialist for elderly, I handle those situations pretty well. I understand the person's situation, and I go through the process with them, down, sometimes down to the T, as to how they want to go, who they want to see, and those kind of things. I handle the hard questions for everybody that people don't want to go in the room and ask. I'm the person they send into the room to ask. But I find different ways of asking. It's like I said in other videos, I kind of personalize end of life care for somebody. That gives them dignity at the end. That shows them that their life means something. That makes it meaningful for them when they see you following their wishes at the end of their lifespan. So I thought I'd do D for the night. For now, Gator Wellness. Take care, folks. See you tomorrow for shows.